Kyle Glass, so I'm the CFO of the West Volusia market here with AdventHealth, which covers AdventHealth DeLand and AdventHealth Orange City. So actually came up in one of our presentations at a company level. Our colleagues in West Florida had been struggling with nurse recruiting the same way we all were, and had tried out this thing called virtual nursing to supplement their workforce. And we spent some time talking to them and looking at that across our division to understand, given the challenges we were having recruiting, finding nurses, would this be a viable option for us? And that's when Banyan kind of came into play as an option for us, I think, to supplement our nursing workforce. I think it originally came from my CNO up through our division CNO and clinical leadership, and eventually along the way they loop in finance somewhere in there to take a look at it. The team has been great to work with. I have yet to meet anybody from that team that has been easy to talk to. The presentations and how the product will work have been great. The demos were great when we walked through that process. The team has been available for questions and comments. Even though we were slow on the contract side, they were patient in letting us work through our process, get our IT approvals covered, and sort of guiding us along the way what needed to be done from an implementation standpoint. And I think the feedback from my frontline team has been even better, which is what you care about mostly, right? It's one thing if my experience is poor, you care about the service level at the front line with your nurses, your clinical leaders, and they have spoken well about the interactions, and so that gives me confidence in the overall Banyan team. I think it's been interesting. From a patient experience standpoint, I think it's new to some folks, right? The thought that it's one thing if I do a video visit with a doctor and I call that physician, I know I'm getting a person on the screen. When I get admitted to the hospital, the thought that I might interact with a nurse virtually in my room is different. And I think some people are excited about the new technology and some people have an initial level of distrust, or what is this person? Are they going to be watching me in my room all the time? But the feedback when they learn how it works has been overwhelmingly positive. It's very safe with patient privacy. There's a knock before someone enters, and so they feel like the interactions are respectful, and the way the nurse enters is the same way any other nurse would enter your room, checking with you first. And then I think they feel that they have more time with a clinician spent with them. There's more time taken to go over discharge information, med-rec notes, whatever they have questions on, that person has more time to spend discussing with them and can even go through it line by line with them in their chart, which is helpful for some patients. I think the feedback for anybody that's been admitted to our hospital and had a virtual nurse as part of their care has been positive in retrospect. They've liked the experience, liked the time that got spent with them, and overwhelmingly, I think they feel that the care was not diminished at all, and if anything, they had a little bit more chance to interact with the nurse, and that's what people really care about, is what their experience was like, what the feel of that touch point was like, and the interactions have been positive as far as the nurse themselves. The way they interact with the patient has been very helpful. So once they've tried it once, they're very open to trying it again. Ideally, someone's not admitted multiple times, but I think someone who's been through that experience and then comes back, they're asking, will I have the virtual nurse again? That was a great experience. And if you ask them the second time, they're overwhelmingly likely to say, yeah, that was a great part of my care. I'm more than willing to be in a unit like that again. What types of results are we seeing from the program at this stage? And we're early, right? We're 6 months into our launch, if you will. And there's a learning curve that goes with that too, as your team tries to optimize around the new product. And at the same time, we're coming out of COVID, which is a unique time in healthcare, and we're trying to optimize and get ourselves back on track to the way healthcare was delivered pre-COVID. And so we've seen drastic improvement in nursing turnover, in fall reductions, in length of stay. And some of that's happening across the entire facility, but the units specifically that have virtual nursing are showing very positive results in those metrics. We're optimistic about what it will do for recruitment, to attract new candidates when they see that this is a support option in those units. I think we're hopeful that we'll see some of those results come in as you can actually find nurses and get them in. But so far, it's too early to tell on some of those metrics, but the initial indicators have been positive. The patient experience scores have been helpful. And honestly, for me, the biggest win for us has been the reduction of work intensity for the actual frontline nurses. We have measurable results that show the number of touch points a nurse has to have with a patient. The physical nurses that are on the unit have to have with a patient is reduced. They get to spend more time in their charts, get to spend more time documenting, get to spend more time reviewing patients' records, medical history, and operating at the top of their license. And some of the basic functions, the call lights, other things that take up time during their day are reduced significantly, which is a huge win for your nursing workforce. Helps your retention, helps your overall quality of care, your documentation scores, which finance folks care about. Those metrics are very promising for the first 6 months. I think we're waiting to see when you have a more lengthy trend, what length and stay and some of your other indicators look like. So I think we're evaluating rolling out Banyan to other locations, rolling out virtual nursing to other locations, more units, more clinical spaces. I think the thing we're considering is how we message that to the frontline team and understanding that it is going to take work off their plate, and so this is an alternative nursing model to move into versus simply trying to hire enough nurses, which we have never been successful with, or we have not been successful with for the last several years. The challenge is the phasing and how do you roll it in the right way and not go live everywhere, and there's a planning process that goes with that. But yes, I think we are evaluating it. Really, I think we're all aware you're not going to find enough nurses. The U.S. is not producing enough nurses every year. I can't tell you the number of reports I read or get forwarded from my CNO saying we don't have enough nurses in the country. There's a national nursing labor shortage. And so in healthcare, we're going to have to lean into an alternative model of care. And virtual nursing provides that option of somewhere for us to pivot to and say, we can get the team the support they need with more efficient use of resources and just accept the reality of you're not going to find enough nurses to get to your optimal staffing model if you're waiting for graduates and waiting for more nurses to be produced in the U.S.